And welcome into To Your Health. You know, you watch TV, you see commercials. Many commercials come on that talk to us about as we age, some things happen to us. One of them is our skin. It can become a problem. Well, today we're very fortunate to have with us Dr. Porcia Love, and you are a dermatologist.
Yes.
And more importantly, a brand new mother.
Yes, definitely.
And you are radiant from that little girl.
Oh, thank you.
And you said
so
she's
much.
almost 3 months old.
Almost 3 months.
Isn't that nice?
She's been a blessing for sure.
Well, aren't they all?
Yes, definitely.
If we all would realize that, the world would be a lot better place. Yes, indeed.
Thank you.
But you're a dermatologist,
I
and we
am.
were talking about the fact that as we age, our skin starts
Our skin definitely changes. There are two main types of aging. There is intrinsic aging, which is determined by your genetics.
Okay.
And so that is when you lose the fullness of your skin and it becomes thinner, per se. But then there is extrinsic aging, which is determined by what we do in the environment. And so that is what has a huge effect on our skin and what we can do to help protect our skin and help us age gracefully, as I say.
Good. We all are looking for that. That's the reason we're doing this show,
Exactly.
so we can all age gracefully.
Maintain what God has given us.
Absolutely.
The first thing I think everyone should do is wear a sunscreen.
Okay.
Regardless of your skin tone, regardless of what time of year it is. Because even when you're driving in Alabama, you're always getting sun exposure.
Yes, you are.
And it can cause changes in your complexion. It can cause you to tan easily, and most importantly, it can cause skin cancer. And so everyone should wear a broad spectrum sunscreen with a sun protection factor or SPF of 30 or above. And then the next thing, I tell everyone to moisturize.
Okay. Let me go back to just on the sun for just a second, because obviously sun is a source of vitamin D.
Yes.
And they say we're supposed to get a certain amount of that a day.
Yes.
So a certain amount would be okay, but should that still be protected?
Yes, you should definitely. When you get up in the morning, you can often combine your moisturizer with your sunscreen. It can be in one product. And just put it on your face. And then during the summer months when you're at the lake or the beach, make sure you put it on sun exposed areas.
Absolutely. You're playing golf.
Yes, definitely.
18 holes, 4 hours in the sun. Yeah.
Yes.
And you don't think about it.
You don't.
If you're on the beach, you're lying back and you go, okay, I'm going to sun for 2 hours here. But you're out playing golf. You're in the sun for 4 hours.
Yes, and so we see a lot of men with sun changes on their scalp. And so you should definitely wear a hat when you're playing golf, and also wear sunscreen on your arms and things and your hands when you are playing golf. The sun is strongest between 10 a.m. and 2 p.m.
Okay.
And so if you could avoid those times, that would be great.
Then you're talking about moisturizing?
Yes.
Yes.
Definitely, especially with the weather changing. It's drier outside, and that dryness pulls some of the moisture outside of your body. And so what you want to do is replace that. And if you moisturize after you get out of the shower, that's usually best. You want to look for products that contain ingredients like ceramides or petrolatum, which is kind of like Vaseline.
Okay.
But you do want to moisturize your face, your arms, your hands, your legs, and your feet.
Does your skin naturally moisturize itself? And does it do more so when you're younger and less when you're older?
Yes, exactly. That is something that happens as you grow older.
Okay.
You lose that moisture, and so that is why it's so important
to replenish.
And
that's for men as well as women.
Yes,
Good.
And men hate.
Oh, I know. I got to do
men
what?
hate lotion.
Right.
But then if you don't moisturize, you can develop rashes. You can. I have a lot of people who itch a lot, and moisturizing would definitely help with that.
So we're going to close this segment in just a sec, because we're going to come back and get you back another week to talk about some of the food things you do and how they're going to affect your face.
Definitely.
But let me ask, if you're feeling that you have problems, can a person go directly to the dermatologist, or do they normally go to their general practice doctor, and then you're not a referral kind of person?
It depends on your insurance.
Okay.
So we tell everyone to check with your insurance companies to see if you can get a direct referral. We know that Blue Cross Blue Shield, you can you can refer yourself. But there are some insurance companies where you do have to have a referral from your primary care provider.
Good. Very interesting stuff. Thank you so much. We're going to get you back and learn more about how we maintain some good skin.
Okay.
And just remember this, if you feel like there's something wrong, do check with a dermatologist, because they're the ones that can help you maintain a beautiful face, even for a man, a handsome face as we age. We'll be right back right after this.